Hello, I'm Tracy Shulsinger, a family nurse practitioner. I practice functional medicine, and I'm here with Dr. Joseph Cohen, and he practices functional medicine and cannabis medicine. And today we're going to discuss autoimmune disease. So Dr. Cohen, what are the numbers? How many people actually are living with autoimmune disease in the United States?
I've seen recent statistics that say approximately 50 million Americans have some form of autoimmune disease. So it is 1 out of every 6 potentially with autoimmune problems.
Wow, that's a lot of people.
Very common.
And so for anyone who either knows that they have an autoimmune disease or thinks they might have an autoimmune disease, what's going on in the body?
Well, when you have an autoimmune disease, you're basically talking about some dysfunction in your immune system where your body is actually damaging your own cells, and that's what happens with autoimmune disease. There are several different factors that actually cause autoimmune disease, one of which is going to be a trigger. Secondly, you have to have a genetic predisposition. And third, you have to have what's called a leaky gut or permeability issues with your intestine. So what we found over the past 6.5 years at Holos is that the genetic predisposition appears to be the gene for gluten sensitivity. And the trigger, obviously, then, is gluten. So gluten is found in wheat, rye, and barley. We eat a ton of wheat, so we are seeing a marked increase in autoimmune diseases since that's the trigger. There are secondary triggers, stressors, whether it be physical or emotional stressors, that add to the problem. So people can have the 3 initial things, the leaky gut, the trigger, and the genetic predisposition, but never develop autoimmune until they have another incident in their life that brings them over the edge.
So it's like a perfect storm of several things coming together and creating an overwhelm in the system.
Exactly.
So when we're talking about autoimmune diseases, I know there's many, and can you name a few, some of the most common autoimmune diseases?
Sure. What I see mostly in my practice is going to be fibromyalgia, very common, rheumatoid arthritis, multiple sclerosis. I believe that endometriosis is autoimmune based.
And then I treat a lot of thyroid conditions and hormonal conditions, and I see a lot of people who have Hashimoto's thyroiditis, which was the first named autoimmune disease and one of the most common ones. So for cannabis application, we've talked about the holistic approach with diet, and I hope we've mentioned stress reduction is really, really important. But what about how does cannabis help people who have autoimmune diseases?
Well, it works in many ways. Number one, it is a great stress reliever. But THC is the psychoactive part of the plant. CBD is a non-psychoactive part of the plant. And what CBD does, it actually directly heals the gut through producing a substance called claudin-1. In addition to that, CBD and THC together work on all of the symptoms that are related to a multiple number of autoimmune diseases. So you can treat with a 1-to-1 ratio is what we found best. So we recommend in 2 different forms. We'll recommend that people use something like a vaporizer, like a PAX, and inhale to make sure they're getting a 1-to-1 ratio strain whenever they need to alleviate some of the symptoms. We'll also recommend as the mainstay something like a tincture in a 1-to-1 ratio, where they can put a certain number of drops under the tongue. They can do that morning, late afternoon, and bedtime, so they have a constant blood level going, and then boost with the vaporizer.
So we can't really change our genetics, but we can change the expression of our genes, which is a field of epigenetics, by decreasing our triggers, by healing our leaky gut, by avoiding foods that are inflammatory, and by using cannabis. So it's a really great holistic approach.
It is, and it's very, very effective for our patients.
Wonderful. So can you share some success stories that you've seen on the effectiveness of this approach?
Sure. We have autoimmune diseases is probably one of the most common things we see in our practice. So I'll mention a patient who has both fibromyalgia and rheumatoid arthritis. She had a family history of rheumatoid arthritis where her grandmother had very distorted fingers. She herself was having issues with sleep, with pain, generalized pain that we see in fibromyalgia. as well as the rheumatoid nodules in her fingers. We put her on a gluten-free diet, and she was on that diet for approximately 2 years before her nodules completely recovered. She was using a 1-to-1 ratio tincture, as well as inhaling through a PAX whenever she needed to use it for sleep at night or to get a boost to reduce her pain.
Wow, so that gives us a lot of hope. We often think of autoimmune disease as irreversible and progressive, but you're seeing patients in your clinic, and I see patients as well that are going into remission or are healing.
Yeah, and it takes 3 factors. You have to remove the trigger, you have to heal the gut, and there's many gut healing formulations through supplements that we recommend. So if you're on the right diet, removing the trigger, you're healing the gut, and you're using about a 1-to-1 ratio CBD to THC, that's your formulation right there.
Wonderful. Well, that's good information to know and to be able to share with you. Thank you for listening. Dr. Cohen, thank you for your time and your expertise and for giving so many people hope.
Thank you, Tracy.